Hello everyone, my name is Jessica Sennett and I want to welcome you to my core breathing video. I'm very excited because I feel that every client that I work with, whether you're working with me one-on-one, in an online program, in a group program that I'm teaching, you should all have the foundational knowledge of why it's so important to build a strong foundation for exercise before you actually start to exercise. And I'm gonna preface this right now with saying that it's not the sexiest, most exciting stuff, but it is the most important, okay? Most of the clients that I work with are women, and they're either thinking about having a baby, pregnant, or postpartum. And postpartum can mean 6 weeks postpartum, 6 years postpartum, 60 years postpartum. That's a little much, but you know what I'm talking about, right? No matter what stage you are in your life, or even if you are a gentleman watching this video, we all need to identify these muscles, understand why it's so important to strengthen them, learn how to strengthen them and how to use them as we exercise so that we can be more functional in our everyday life. I'm going to throw a lot of anatomy at you right now, some mechanics at you right now. Feel free to watch this video over and over. If this is the first time you're hearing some of these things, it's okay not to get it right away, okay? And I'm gonna talk about that a little later. It is a process, okay? But I want you guys to have the knowledge so that you can, not only understand why you're doing what you're doing, but kind of use it and prosper and, have less injury and work just more functionally, okay? So here we go. So the core. We have to know what muscles we're working before we start working them, right? So when I say your core, I'm talking about the muscles between your ribs and your hips. I'm primarily talking about your inner core unit. There are lots of muscles that are involved in stabilizing your core, but when I talk about how to strengthen that inner unit, I'm talking about 4 muscles, okay? I'm talking about your diaphragm, your TA, which stands for transversus abdominis. So I'm going to use the short form TA in the whole video. Your pelvic floor and your deep back muscle called your multifidus, okay? Your diaphragm sits underneath your ribs just like an umbrella and contracts down when you breathe. It's your primary breathing muscle, okay? Then we're talking about your deep abdominal muscle, your TA, and that actually connects right at your sternum here. It kind of mingles with your diaphragm. It spans down the inside of your body along the inside of the ribs. The middle part of your TA actually comes and attaches into your lats, which is the big muscle in your back, and it attaches on your iliac crest, your ASIS on your pelvis, okay? Now, your TA is connected to your pelvic floor. Your pelvic floor, I'm super excited to show this to you guys. Your pelvic floor is the diamond-shaped sling of muscles at the bottom of your body. And it's super important. We don't talk about it enough, especially if you're prenatal or postpartum. Lots of functions for the pelvic floor. It's a sump pump. It's used for sex. It's going to help push your baby out. It helps you poo and pee. Super important. And it bears the weight of all your internal organs. And if you're pregnant right now, it's holding the weight of your baby up. So it's got a ton of jobs to do. So I'll show you what it looks like. Let's get rid of your bladder. This is uterus, rectum, bye-bye. And if you can see, that is your pelvic floor on the inside. So it actually attaches from your pubic bone, which is this guy here in the front, to your tailbone. My tailbone actually fell off here. It doesn't stay on this model. There it goes. It's only a magnet. Your tailbone in the back, and then your 2 sit bones, if you can see, right on the side, right? Here's anus, okay? And here's your vaginal opening, right? So very important to know where your pelvic floor is and how it's involved in strengthening your core. Your pelvic floor is connected to your deep back muscle, which is called your multifidus. So it makes like this core box, okay? Now, there are many other muscles that are, that affect the core, like your inner and outer obliques, your rectus abdominis. That's the muscle on top of the TA. That's your six-pack muscle. I'm talking about, your lats. Your glutes are really important with your core, but for our sake of learning how to manage, how to engage, we want to talk about these four muscles because they are the most important when you're managing pressure. And I'm going to talk about pressure a little bit more as we go. If you need to kind of rewind, go for it because I'm going to throw even more at you. Okay, so these four muscles, they work together, okay? There's a synergy going on. When one contracts, they all contract. When one is off, they're all off. We know this from many clinical trials. We know this now, okay? And between these muscles, this is your diaphragm, if this is your pelvic floor, we know they work together. They create a pressurized system within your whole body. And it's a special name for it. It's called intra-abdominal pressure. It's a pressure system. So think about a bag of chips. When it hasn't been open yet, there is a pressure. You can push on it a little bit, but when you break that bag of chips, all the air goes out and it's not as strong. So there is a pressurized system that gets affected as these muscles contract and relax. And it's this pressure system that makes it so that you don't keel over at your ribs. We want pressure. We need pressure. We actually know that your body's super smart. It's maintaining the pressure as you sit here and talk to me right now. It adjusts the pressure as necessary. So that's why it's so important to understand how these muscles work so that we can kind of manage the pressure as we do more things that require more pressure. There are many things that can change the pressure of your internal system. And one of them being actually breathing, engaging and relaxing those muscles. Other things are position, different positions that you can be in, how heavy things you're lifting, how far you're lifting these things, how high you're lifting these things above your head. There's so many other different ways you can change the pressure from the inside of your body versus the outside. But for our purposes now, we want to learn how to maintain the pressure just by breathing. And we're really only concerned with we're really only concerned with those four muscles I talked about and maintaining the pressure, okay? So, how do we maintain the pressure? We have to learn how to breathe, right? Because we know if we breathe and we contract those those four muscles together, they will maintain the pressure and they will work together as a synergy, right? So I'm just going to walk you through the basics of core breathing. First, I just want you to take a few breaths. Just take a few breaths. You can close your eyes. Don't think about it. Take a deep breath in and a deep breath out. And I just want you to notice what part of your body is moving the most. Is it your chest? Is it your shoulders? There's no right or wrong here. We're just learning. So if you notice that you were the most movement in your chest or your shoulders, that's totally normal. All our society breathes this way, right? We want to put most of the movement not in our chest and shoulders, but in our diaphragm, our ribs, and our TA, okay? So start to breathe with me as I talk you through it. On an inhale, we are going to take a big inhale. Your diaphragm is going to move down. Your TA, your transverse abdominis, is going to expand. And I want that to be a feeling of expansion in all directions. On the top, the middle, the bottom of your belly, and even into the sides. It's called lateral costal breathing. So you want to feel this 360 expansion in your whole body, okay? Again, on the inhale, after TA is going to expand, you're going to release your pelvic floor, relax your pelvic floor. And that can be felt many different ways. If you've never felt your pelvic floor before, it's that release you get when you're sitting on the toilet and you're peeing or you're pooing. That's what I want, but don't actually pee or poo. There's much imagery you can use as well. Some people use a flower opening down there at the bottom of your body, right? If you were holding a blueberry up in your vagina, you can release that blueberry. You can, some people think about a balloon expanding down there. Anything that helps you relax the pelvic floor, totally cool. That's what's going to happen on the inhale. On the exhale, this opposite is going to happen. You're going to lift and engage your pelvic floor up. So it's like sucking a big milkshake up through your vagina, through a big straw. Picking up that blueberry, pulling it up into your body, okay? Slowly and controlled. Your TA is going to move in on a full excursion all the way in, and your diaphragm is going to move up. You're not actually going to feel your diaphragm move. The most movement and the muscle responsible for maintaining the pressure is your TA, and this is what I want. So I want you to practice now. Inhale, relax everything. Exhale, contract and engage. And you can feel, keep breathing as I'm talking. You can feel as you exhale that this muscle is getting a little hard, and you're actually creating pressure in your system. And that pressure is giving you the support that you're going to need to press weight over your head, to do a squat, to do a deadlift, to do anything that you need to do, not only in your workout, but for your everyday life too, picking that toddler up into the car seat, whatever you need to do, okay? These are the basics for your core breathing. If this is new to you, I want you to practice 5 minutes a day, okay? It doesn't happen overnight. I've been doing this and teaching this for years, okay? Rewind this video, go through the anatomy again, and practice. And keep in mind, if you are working out and trying to get the breathing and you're screwing it up, it's okay. Just keep in mind, I don't want you to hold your breath. When you hold your breath, it's creating a pressure system in your neck, right? It's your body craving stability that you just don't have here. We always want to exhale on the hardest part of an exercise and inhale when we're recovering. So let's say on a squat, you're going to inhale on the way down, exhale on the way up. For a push-up, you're going to inhale on the way down, exhale on the way up. If you find that you're holding your breath throughout all of the reps because it's so hard, take your time, shake it out, just breathe through the change. I'm more concerned with you breathing than doing it right, than not breathing and holding your breath, if that makes sense. I'm telling you guys, practice makes perfect. Before I go, and I know if you sat with me through this whole video, congratulations to you. How do you know if there is a mismanagement of pressure from your core versus the inside versus the outside? If you're doing any exercise and you feel pain, you get pressure on your pelvic floor, you get leaking, you get lower back pain, or if you get a doming or a coning, just notice that doming or coning, that's your diastasis recti. I talk about this more in detail in another video of mine. That's just your body's way of telling you that there's some pressure going on, and you may have to adjust what you're doing or modify. Seeing doming or coning isn't necessarily a sign that you have to change. If you haven't been using your core breathing strategy, now would be a time to further engage more, okay? So those are all signs and symptoms that there's a mismanagement of pressure. You're not engaging your TA enough to manage the pressure versus the inside versus the outside. All right, you guys, that is your introductory to core breathing. Use it in your workouts, use it in your everyday life. Reach out to me with questions and go have fun.